Good morning, everyone. This is Dr. Rezaie, palliative medicine doctor here at the Center for Cancer and Blood Disorders. And I'm here today because I wanted to talk about this latest ban that just started today here in Texas regarding hemp-based products that contain illegal amounts of Delta-9 THC and other synthetically created THC forms, such as Delta-8 or Delta-10. I know a couple of years back, during the last legislative session, SB4 was a bill that was being passed to regulate the hemp industry and to curtail the production of these synthetic THCs. And the main reason is because when people in the community seek out hemp products from their local shops without a prescription, you don't know exactly what you're getting. You know, packaging is supposed to tell what is in the product, so a patient or a person who goes and acquires that, whether it's for recreational purposes or medicinal purposes, they know what they're getting and they can trust that the product is safe and tested. However, in the hemp industry, you're not seeing that. So with this, and the way this ban came about, it was from the Texas Supreme Court ruling back in 2021 that was to basically enforce that Delta-8 and other synthetic hemp-derived THCs were going to be classified as a Schedule 1 controlled substance. And then when we look at the controlled substance schedule, Class 1 means that there is no medicinal value to it. Now, that's different from what's going on in Washington with the FDA to try to get cannabis rescheduled. So that's a whole different thing. But here in Texas, as of today, hemp distributors, hemp retailers are not allowed to sell any hemp-based product that contains any kind of synthetic THC, such as Delta-8 or Delta-10, or they cannot sell anything with Delta-9 THC, which is the naturally derived THC from the cannabis plant. They can't sell it if it has more than 0.3% THC, which is the legally defined limit that hemp is allowed to have. What I want to assure you, though, is that this does not affect the patients that we have enrolled through the compassionate use program, which is how patients can qualify for medicinal cannabis that has been tested and regulated, and you know what you're getting in the products. It hasn't been tampered with or anything. So that is just something I wanted to share to reassure you that the patients who are enrolled in the compassionate use program, your products are protected because you have a prescriber, a physician who's indicated that you have a medical condition that warrants access to the cannabis program. But for the people who are not enrolled, who don't necessarily have a disease that qualifies for them, please be careful, please be mindful that things are changing today in your hemp shops, and largely it's for your safety. If you have any questions, talk to your physician, and if you do qualify, hopefully they can direct you to somebody that can get you enrolled. Thanks.